Yeah. As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Good morning, everyone. It's Friday, December 10th, and I mention that because today's show is a show that's something that really needs to kind of, not only needs to, but it will remain in our archives. My shows are archived, and you can just go to Facebook Live, Tom Ficklin Radio Show. But we're going to talk about Yale New Haven Health System hiring initiatives. And this is important for not only today, December 10th, but moving forward. And we're going to talk about how this health system wants to move forward in terms of its new and really exciting hiring system initiative. I have to just mention Dr. Churchwell and Dr. Belsasak. As I thought about this show, my mind went to Cortland Wilson, whom, as you know, was very kind of a hero, if you will, in terms of Yale New Haven health system. It wasn't called that exactly at that point in terms of diversity and inclusion. So he would be, I'm just very excited. So I kind of dedicate this show to him. But today's show, as many of you know, Yale New Haven Health System is really Connecticut's leading healthcare system. We should not neglect to keep that in mind. But in addition, the system has experienced a tremendous growth and currently has super exciting job opportunities and career path opportunities in many of its departments. So today, stay glued, not necessarily stay glued to your chair, but don't leave your chair, because between now and the next 55 minutes, we're going to hear from various Yale New Haven Health System administrators and community leaders about current initiatives. And as I say, if you do have to kind of break away, our shows are archived. But our guests today are Dr. Keith Churchwell, Executive Vice President, Yale New Haven Health, and also President of Yale New Haven Hospital. Dr. Thomas Belsasak, Executive Vice President, Chief Clinical Officer, Yale New Haven Health. Judith Hahn. Judith is Director of Nursing Professional Practice here in New Haven at Yale New Haven Hospital. And Tisha Johnson. Tisha, Deputy Director and Chief Operations Officer for the Yale Center for Clinical Investigation and Director of Clinical Research for Yale School of Medicine. Dorinda Manor, by the way, Dorinda, if you hear me refer to Dorinda as Dory, she likes to be referred to as Dory, but Dorinda Manor is Executive Director of Talent Acquisition for Yale New Haven Health. And we're joined by two guys that have been around and kind of tolerated me for several shows, Reverend Dr. Leroy Perry. Dr. Perry is pastor of St. Stephen's AME Zion Church and cultural ambassador to the Yale Clinical Research Program, and Reverend Elvin Clayton, his sidekick, and I consider him a very, very dear friend. He's also a pastor of Walters Memorial AME Zion Church and cultural ambassador for the Yale Clinical Research Program. Welcome, everybody, and happy holidays, because I might not see you guys and ladies prior to those events taking place. But Dr. Churchwell, might we start with you?
Sure, Tom. Good morning. How are you?
Good. You have just dawned on me that it's almost, you've just celebrated your anniversary as president, well, this past October, as president of Yale New Haven Hospital. And although you've been involved with the hospital prior to that, but what can you tell us about the mission and values of the hospital? And I realize that's really a rich and loaded question, but it's really appropriate to kind of start with that so people can understand really the commitment and passion that you have brought to this journey and your personal kind of endeavor.
You know, Tom, it's a great question. One can make an argument that I needed to have my head examined on taking this role in the middle of a pandemic, but maybe that's another show at the end of the day. It's been a remarkably busy year. We look across our hospital and really across our health system, what we've had to deal with in regards to the degree of sickness, the complexity of care that actually only has been enhanced because of the pandemic, has been rather significant. It is a testament to all of our employees, our clinicians, our nursing staff, all of our ancillary support, that we've been able to continue to deliver extremely high level of care for all who have darkened our door in these past 12 to 13 months. I say that somewhat prideful, and always pride goeth before the fall, but I'm still prideful nonetheless. And that the degree of consistency, the degree of actually mindfulness for all of everyone who walks through our door in regards to putting our patients first, I think has been incredibly important. You talked about, and you asked you to mention and discuss how it aligns to our mission. It completely aligns to our mission. So you look at our triangle or pyramid based upon your two-dimensional or three-dimensional look at our values, our missions and goals of our organization. Paramount in that is, how do we put patients first? How do we put families first? How do we actually want to and think about achieving the overall maximum care and outcome for those that we have the honor to serve? And the work that's been done over the past months, over this past year has actually, I think, has been a testament to that.
Excellent. And if I might, just as a personal note, I was actually thinking of not being able to be available for this show because a person relative on my wife's side passed away in your hospital yesterday, but the care that she received, the diagnosis, the attention that she received, just was on my heart. So I just want to mention that I hear your words, and what you said from my reality is very true about the compassion and the attention to her particular situation. But Dr. Belcezak, you've been baptized and you've been on the show in the past, but so the last time you were with us, so he used the
He's been baptized. Is that true?
Long time. Well, it is true, but a long, long time ago.
I was about to say.
I was about to say bar mitzvah also, but I did want to kind of get to universal with everything. But Dr. Belcezak, you used the analogy of the coach of a football team to describe your role as chief physician executive of and really it is a vast Yale New Haven health system. What is your vision for this team of quarterbacks and halfbacks and middle linebackers, et cetera?
Tom, thank you, first of all, for having us on the show. I so appreciate you inviting us and giving us some time to answer your questions and reach out to the community and be part of the community. And, I'm so honored to be part of this panel that you put together and to continue to work with you all, and I appreciate it. And second, I'm sorry for your loss. I'm hoping that we could give your family and your loved ones some comfort, and I appreciate you bringing that up. But the football team analogy, I still think, is a good one, because we can have the greatest quarterback, we could have the greatest kickers, we could have the greatest, running back, tight end, what have you. And if you can't coordinate them, if you can't organize them, and you can't get the fan base enthusiastic for that team and get everybody working in the right direction, and it takes a huge community. Keith was talking about our community, and it's bigger than just the folks that work here. It's the patients, it's their families, it's all of us. And you got to have that momentum, like a team that's going into a playoff set of games. And if you can get that momentum, you can accomplish pretty much anything. Keith talked about the challenges we faced in this pandemic. We faced them at home. We faced them with our loved ones. We've certainly faced them here at work. And, my colleagues here can talk about the big challenges we're facing. People have talked about this great resignation that's going on across the country and how people are leaving the workforce. And that's a real challenge for us in healthcare, because we've got that added burden that our staff are tired, as Keith mentioned, and they're fatigued, and they're people too. They're facing the same challenges and the fears and the disruption in childcare and the difficulty, multi-generational households. How do you keep your grandparents and your elders safe when the kids are going to school? All these things, they've got all of that, and then they're coming to work and they're having to do that same care, sometimes with fewer staff on the floor, because we're missing people, and it's a real challenge to keep that momentum for that football team going.
And Dr. Churchwell, it seems to me when Dr. Belcezak referenced the keeping your staffing and camaraderie and just all the troops, all the boots on the ground that that it occurs to me that you reached out to Tisha Johnson Harris about a number of positions open in the Yale New Haven health system, and that you really wanted to get the, let me say, you really wanted to get the word out to the community about these opportunities. So that,
Yes.
and the two of you engaged also the cultural ambassadors in that assignment, brought in the SWAT team. So what can you share with us about, with our audience about the current hiring initiatives and really how this partnership with the ambassadors supports that dare I say, supports that policy?
So, Tom, across our health system, we have over 3,000 open positions that are unfilled, and and some of them actually unfilled well over 6 months, sometimes 12 months. And there are varying degrees of expertise and capability that we're actually asking for, but many of those positions are opportunities for individuals to join our health system and start a path for professional development and develop a path for a true vocation in healthcare. The idea and the opportunity to actually reach out to Tisha and all of our cultural ambassadors to ensure that we are reaching the whole population with this information and with this opportunity that we can help them assess and actually bring forward so that we can have the right and proper discussion and bring real opportunity to the greater New Haven population, really the greater community across this great state, I think it's vitally important to us. In some respects, it's selfish. Selfish in the sense that we need these people. We need great people who actually want to work with us in what we think is a truly, truly great work. And the deficit we have is actually profound. And it is leading to significant stress in our system, as Tom talked about, issues of burnout, issues of actually how we're going to be able to deliver care effectively, not only in the Yale New Haven Hospital, across our health system. So there is a want and desire to bring good people who actually are want to be a part of something larger to our hospital and to this health system. So it was really natural and actually, I think, very smart of us to reach out to our Tisha and our cultural ambassadors to go out into the community to help articulate that message in a way that hopefully resonates and brings more to the table.
Thanks. Dr. Belcezak, would you like to add on? Because I'm told that you use this term, join our team, and that you've also been in conversation with the ambassadors. So as they say sometimes in some settings, break it down a little bit more in detail about what this initiative entails.
Sure, happy to. And let me pick up where Keith left off. We want great people. And what does that mean? That means we want people who have values that we articulate, and hopefully they meet our values. They are compassionate, that try to do the right thing, that are willing to work hard, that understand that we are based in our communities and incredibly committed to our communities. We're not like a manufacturing facility. We're a hospital. We take care of people in our community. We can't pick up our roots and move to South Bend, Indiana. We're going to be here forever. This is because we take care of people. We live in our communities. And for that reason, we want the people who work in our organization to be part of those communities, to represent those communities. And it's really important that when you come into our health system, when you come into any of our hospitals, when you look up from your spot where you're sitting, that person's giving you care, you have somebody who can connect with you. And we need to be in our communities and be like our communities. That's really important to be part of our team. And look, healthcare is a great place to be. Taking care of people nourishes your soul. And I've really enjoyed working in healthcare. I've really enjoyed working in this community for my entire career, my entire life. I can't say enough good things about it. And if there are people out there that want to have a great career, and as Keith said, you can come in and we've got opportunities to grow and to get educated and move in your roles and develop your whole career here and really live your best life. Unfortunately, Ina Williams didn't join us today. Ina Williams is our chief nurse here at Yale New Haven, and it's impossible. I've said this before. It is impossible, and Keith would agree with me, to walk from our offices to the cafeteria and not make it there without having at least a dozen people stop you and say, "Hey, Ina, I'm working on my bachelor's degree, my associate's degree, my master's degree, and thank you for getting me launched on this," because Ina has just been so amazing at being so focused on education And I think probably, I don't know, maybe a third of our employees have probably gone on to get more education because of something that Ina has said or done in order to get them moving.
Tremendous, tremendous. Reverend Clayton and Reverend Perry, let me kind of bring you in because we excuse me, we've had a few shows, and really one of the overarching themes is take ownership of your health. And obviously sometimes money impacts how much you can own, but nonetheless to have the personal motivation and the community collaborative motivation to take ownership of your health is really is a meaningful kind of phrase. But so we use this term, take ownership of your health, to really inspire folks. But we've largely centered and talked about ailments and research projects, et cetera. But today we're talking about employment and sustainability and career paths. Just wondered, Reverend Perry and Reverend Clayton and Reverend Perry, I'll start off with you, but how does this conversation about jobs and employment and aspirations feed into the mission of improving health outcomes from your perspective? Reverend Perry?
Tom, thank you for allowing me to be here. And I have to tip my hat to our coach and quarterback, Tisha Johnson Harris, because she makes things happen that I can't make happen. And I do appreciate all that she does. I think that if we look at the social determinants of health, we have to understand that what is probably missing in that equation is employment. And so the idea that now we are launching this program, I think that's essential to the growth of our community. And I think that, the mere fact that this program will offer skills and training, and those are the things that we were looking at as cultural ambassadors with our internship programs and our exposure program, which we're starting, because we want to get ready for this. We want to build into this because it can be impactful, not only in the hospital industry, but in the community at large. So I thank you for this show, and I think this team, that the Yale Hospital System, for for allowing us to look at the possibility of doing that. I just want to add one caveat to that.
Oh, sure.
You have to ask yourself the question, why are 3.2 million people leaving their jobs? And it just seems to me, when you're doing this employment study, there ought to be something in your mind that says, how do we keep them? What are the incentives? How do they grow? How does a mother go to work and knowing that her child can't go to school? What kind of things may we be able to do to help in that process? I'm just throwing that out. I think that's something we need to look at in this whole process.
Excellent. And we're going to come to Dory, the Executive Director of Talent Acquisition, about some of the positions. But before we do, Reverend Clayton, would you like to kind of weigh in as well in terms of that question?
Thank you, Tom. Thank you very much. This show really is a great show. In order for us to move in the area that we need to move in, money is important. There's a text that says money answers all things. And in order for people to even be able to afford adequate health care, they need money. In order for them to pay for the housing that's needed, they need money. In order for them to take care of the education for their children and buy healthy food, fruit and vegetables, instead of relying on hot dogs and canned goods. In order for them to buy transportation, employment is key. So this program is major, and we're grateful that Yale is reaching out to the community so that we can get this word out, that there are jobs available, even entry-level jobs for people who may not have the education as yet. So this is a wonderful opportunity.
Dory, let's dive in. Again, I know your official name is Dorinda Manor. This is our first laying eyes on one another, but I've been advised to call you Dory, and you can call me Tom. But you're the executive director of this talent acquisition initiative and policy statement, and you've also met with the cultural ambassadors to to discuss how to build a pipeline to careers in the medical system. Tell us a little about the positions that are available and how you're working with the ambassadors, not only now, but in the future to connect folks to jobs.
Sure. So I think Dr. Churchwell and Dr. Balthazak, they really put it in good perspective. We do have a lot of positions that are available, and from all, from nursing to radiology to EVS to food service. I mean, every single department, pretty much, we are looking for, really great candidates, and we're looking to fulfill these roles with the folks that we in the communities we serve. And I've had the pleasure of working with Reverend Perry and Reverend Clayton on how we're going to, institutionalize this, implement it. So we are working on a flyer to get out to all the community ambassadors to share it within their communities. And then also they're going to be able to apply on our website and then put in YCCI ambassadors so that we can make that connection and track these folks. And then also work with Reverend Perry and Reverend Clayton and their team to really identify and ensure that we're following up with those candidates.
Excellent. And we're going to come back again to repeat that information about how folks can access and participate. And Tisha, you've been patient. I'm not sure whether people have used the word patient to describe your personality, but that's a different matter. But we know that much of what happens in the healthcare system is informed by the work of clinical trials and investigations, and the new drugs, the new innovations, the medical technology. I mean, all that starts with getting approvals, and to get approvals, clinical trials and investigations are fundamental, the baseline. But can you tell us about the job opportunities that exist in this area of research? Because it seems to me that this is just as exciting as well, to be involved with groundbreaking research and innovation.
Yeah, absolutely. And, I want to join Tom in sharing my condolences for you and your family's loss. Our thoughts are with you. And thank Keith for referring Dory and talking about this. I think the referral might have come because I was bragging that Reverend Perry and Reverend Clayton are our secret weapons and probably our most powerful recruitment tools, because they've been able to talk several individuals into joining our clinical research team. And really excited to just talk specifically not only about the jobs clinically, but the jobs in research, where we really organizationally intersect, because part of how we think about care in our system and this patient-centric approach that Keith and Tom have mentioned, that really comes from this place of first thinking about compassionate care and participation in the community, is this innovation. We also want to make sure that all individuals have access to clinical research and clinical research opportunities, to consider that as an option when they're thinking about care. And we want that to be across our entire delivery network. And that takes people. And so just like the clinical jobs, we have a lot of, research jobs. The research jobs are in most cases a bit more specialized, which is why we've been working really hard with Reverend Perry and Reverend Clayton and the cultural ambassadors to stand up our internship programs, so students understand at an earlier age what job opportunities look like in both healthcare and research, and stand up our fellowships and exposures program. And so we do have, vacancies there, but we want to make sure all of the nurses and research professionals that might be listening, or individuals who might have an interest in research, know that there's lots of opportunities across our delivery network at Yale University, as well as Yale New Haven Health System, in the space of care and research. And like the health system, the jobs here give tremendous clinical research opportunity. They give opportunities not only for individuals to think about entering a clinical research career, but we spend a lot of time and energy in thinking about, as Reverend Perry mentioned, how does someone grow? We don't want them to start and feel like they're in a dead-end job and they have no opportunities to grow for them and their family. Educational assistance is a big part of how we think about career options within both organizations. And so it's just really important, I think. And also for us, one of the reasons that we wanted to partner with the ambassadors in these initiatives is the ambassadors have been just so effective at helping us spread the word about clinical research and making sure clinical research is open to all populations. We want to do the same thing for our employment opportunities. We want to make sure that everyone knows that they are welcomed at Yale New Haven Health System, at Yale University, and that we are looking to make sure that across all of our careers that you see diversity and it's reflected in not only our mission and what we're trying to do, but it's reflected in the people that you see when you enter our clinical trials, when you enter our care centers, when you enter our hospitals and our clinics. And so I'm just thrilled to be on the show. Patience is not one of the words used to describe me. So we really want to get people activated and moving after the show, and look forward to continuing to work with you to get this message out.
Tisha, if I might, as a follow-up, and thanks for giving me the clearance to use that word. I would say when you're passionate and energetic, yeah, things have to move. And even on that note, if you could share a few words about the summer internship program. There was some publicity about that, but I think people don't understand. We take so much for granted here, I think, in the area about pizza and we've been groundbreakers. So share a little bit about the summer program.
I can't take a lot of credit, and I want to thank both Dr. Balzazak and Dr. Churchwell for being speakers. They really motivated our young minds. But Reverend Perry and Reverend Clayton came to us and said, we're really concerned that there's not enough activity for our kids this summer. You know, a lot of activities were canceled because of COVID. We want to make sure that we have opportunities that really are thinking about all children, and we don't want anyone left behind. And so we set up a virtual internship for 4 weeks, and really focused on, kids. Most of our kids in the internship had never participated in an internship before. It was, we had kids not only from here in Connecticut, but across the US and even in Canada. We had some from the territories in Puerto Rico, and they really got a chance to learn about clinical research opportunities. They did some projects, and actually, most of the interns who joined us for the summer, we had 36 interns total for the summer, aging from 15 to 20. And 32 of them decided to stay with us for the year and are continuing. And as Reverend Perry mentioned, we're trying to get geared up now to take another cohort of high school interns and even start at a younger age with the exposures program that they're designing, where we're going to try to start at middle school. So kids really understand that there's a pathway. They can start thinking about options in high school and in early college, or they can start thinking about trades or other things through the programs that you're going to hear about from Dory and Judith, and really think about healthcare and careers as options. And not all of our careers are just doctors and nurses. That we've got pharmacists, we've got technicians, we've got specialists in research and regulatory, and it really stretches the gamut. Data opportunities. And so that's really what the internship was about. And again, it was really the idea of these two brilliant gentlemen on the phone who are constantly pushing us to be better. And we appreciate the pushing, because I think it's really turned us into some innovators in this space.
Excellent. Thanks for sharing that, because I wanted people to see how you're building a continuum, a real and active and proactive continuum. Dr. Hahn, you've been patient, and Judith Hahn is Director of Nursing Professional Practice. But Dr. Hahn, needless to say, you played a vital role in really acquiring a significant grant. Reverend Clayton referenced the economic impact of money, but you've acquired a significant grant that has been awarded to Yale New Haven Health System to fund this hiring initiative. Tell us a little bit more about it. This is your day of the shine.
Thanks so much, Tom, and thanks for having me. I'm so excited about this grant. It was early in COVID, and we were approached by the State of Connecticut Department of Labor Office of Apprenticeship. We had worked with them in the past with a nursing initiative, and there was an opportunity put forth by the federal government, and the title of the grant is a mouthful. It's the State Apprenticeship Expansion, Equity, and Inclusion Grant. And so really the focus was to be able to get people back to work if they were displaced because of COVID, to also focus on diversity, equity, and inclusion, and to really focus on career growth. And so we took some serious looking at what our needs were. And from my perspective as a nursing leader, our nursing teams really rely heavily on our unlicensed assistant personnel, or what we call our patient care technicians. Like Dr. Balsasek said, it's all about being a team sport. And those folks are the ones that are with our patients during their most intimate times. They're the ones that really spend a lot of time directly at the bedside, interfacing with families and patients. And so the requirement for that job historically has always been a nurse's aide certificate. But based on where we are in acute care in 2021, we know that they need more. And we've been dying to really come up with a rich curriculum that includes things that that they really need. One element is they interface with a lot of technology, and we need to spend some more time investing in developing their tech skills. So what we did is we designed an entire year-long internship, and it includes 4-hour seminars once a month. And the topics are things like mobility, infection prevention, communication, comfort measures, and death and dying. And we also sprinkled the whole program with career planning. Our goal is that these folks have opportunities after their first year. We will have them going to simulations with interprofessional partners, and we're going to be measuring outcomes. I believe strongly that with the investment in this population, we're going to see improvements in decreased patient falls and less infections and higher patient experience scores. And certainly we're going to be measuring their turnover rates, and our goal is to keep them with us forever and to make sure that they also have opportunities to grow. So just really excited about our new grant.
And you referenced, I think, by nuance, but I guess wanted to be a little clearer. How do people, are these for current employees or people that are at Gateway Community College? What's the?
Yeah, so currently we will be enrolling every single new hire that gets hired in a patient care technician role. They'll automatically be enrolled into this year-long apprenticeship. And those positions are posted on our website. But I encourage anyone who's wondering about healthcare and is concerned about getting that initial nurse's aide certificate. We also have opportunities to connect them with resources in the state of Connecticut to get that done. And it really is not that difficult. So anyone can reach out to me directly or to Dory Manor.
And the link, you mentioned the grant, is it a time sensitive grant? Is it a 2-year grant, 5-year grant? Do we use some of Tisha's salary to supplement the grant?
No, it's a very rich grant. Honestly, it's $10 million over 4 years. So we've been able to hire staff to administer this grant. And what is so unique about it is that each individual gets a mentor for their first year. And that mentor is someone who really will be spending clinical time with them. They're all RNs, and they'll be working with these folks on their shifts while they're working to ensure that they are able to apply what they've learned every month in their seminar. So
excellent.
So excited. Thank you.
Excellent. Reverend Perry, Reverend Clayton, let me kind of come back to you. It's such a temptation, Reverend Perry, not to say Odinga when I had to really practice saying Reverend Perry, but that's kind of an inside joke thing. Reverend Perry, we've known each other for almost 5 decades, believe it or not, everybody. But we found, thanks to the good graces of Yale New Haven Health System, a generation drug, a drug to keep us youthful. So we're taking that as part of our withdrawal. But Reverend Perry, what are some of the things that we need to do to support our community? I mean, it's kind of a generic question, but a perpetual question, a perpetual daily mantra. What do we need to do to support our community in being able to take advantage of these opportunities?
Well, Tom, I think Tisha mentioned some of the things we were trying to initiate. I had spoken to a friend of mine, Judge Mosley in Waterbury, about what we were doing with this internship program, and helped him to initiate this process with the Waterbury school system and with the Granville Academy. But this is part of what we need to do. When we talk, Howard Thurman used to talk about head and heart. And so we got the head here, but you got to have the heart to really make all this come together. We have people in our community who have the Pygmalion in the classroom syndrome or low self-esteem. People who tell me I try to apply at Yale, but they don't listen. I never got a call back. So what we're doing now is we're tailoring a process where we can follow up with these individuals and encourage them because we love them and we want our community to prosper and to grow and to keep giving them the inspiration that they need to apply and to say, if you just got to trust God here. These folk are really here to help you and to help you grow. And so I'm hoping that through our efforts together with the ambassadors, I've already got people in my church and the community are saying, when can we sign up and sign on? And I told Dory I want to do all 3,000. I want to be the one to say I got all of them there. So
I said I would enjoy that.
And you said you'd buy me an ice cream cone. That's right.
Reverend Clayton, please weigh in.
Thank you, Tom. First of all, Yale is doing a tremendous job of reaching and helping our community. Even programs such as the Tom Ficklin show that is reaching people at this hour. We're using newsletters and flyers. And you know that the churches are involved, our community action groups. It doesn't stop. We're doing so much through the efforts of YCCI to make sure that people's lives are improving, a well-rounded body, soul, and spirit.
Indeed, just when you mentioned the spirit word, I just want to reference folks. You might have heard Reverend Perry mention the word Howard Thurman. As we approach this holiday season, regardless of your ideology or philosophical or denominational belief, I would encourage you to kind of Google Howard Thurman. You heard of Martin Luther King's name, you've heard of Al Sharpton, Jesse Jackson, and others, but you may not be familiar with somebody called Howard Thurman, Thurman, but it is on my heart to say that I am encouraging you to kind of just Google his name and look at some of his YouTubes and his videos and even some of his books in terms of the head and heart, the connection. Tisha, I want to go to you just for a second before we close out, and I want to give folks a chance to talk about access and whatever might be on their mind. But Tisha, you were also involved with a very significant historical collaboration and coalition with Yale and the city of New Haven. How does your role in that regard relate now to your current role? Because I think people have missed it. They really need to understand that this is monumental in terms of what Yale and the city have decided to do moving forward in terms of the power of economic access.
Sure, happy to. I was asked by our dean, Dr. Brown, and our president of the university to participate as a representative from the School of Medicine on a committee with the city of New Haven. We had individuals who came together over the course of multiple months to think about economic opportunity, to think about the way that the university contributes to the city of New Haven and the growth of the city. And so we were able to come together on that front. The finance committee, I'd say, did the heavy lifting. My colleagues, Doc Callahan and Lauren Zucker, partnered with individuals from the city and volunteers to come up with a financial model that led to additional financial contributions by the university. And within the context of our committee, we focused heavily on some of the messages that we're lifting up here today, thinking about jobs, future economic opportunities, and there's going to be a new institute that's set up that's going to look at some of these things. And so very proud of the hard work of the many individuals within the committee. There was a press conference that really highlighted many of the activities, and I think that link's still active on the university website, where individuals could see specifically the information about the programs and about the additional financial contributions of the university to the city specifically. And I know that there were multiple news outlets that covered it. And so it's a part of what we're thinking about and talking about here today. And although Yale New Haven wasn't a party to that specific agreement, both organizations, we, as Keith and Tom, Dr. Balzazak and Dr. Churchwell mentioned, we are here in the community and passionate about the community and passionate to make sure that there's impact and that we drive to impact. And so both organizations contribute, so heavily to the community, not just financial resources, job resources, access to care, other things, but the passion of all of the individuals in that serve and work at the organizations, and that comes through every day in all of our interactions. So I just want to make sure that comes through. So, but we can share the link and make sure that you have that for the show to share information with your listeners specifically about that. And since you slipped a question in on me that's unrelated, I'm going to just take the opportunity for the floor to remind everyone of the primary goal that we had when we started the Ambassadors, of making sure that clinical trials and clinical trials access are for all. And we do continue, even as, we start to see higher numbers in, COVID positivity. I want to make sure everyone thinks about, vaccination continues to follow COVID protocols, but we also still have very active clinical research programs that are going every day. And you can find information about our clinical research if you're if you have MyChart, as many of our patients do. You can just go to MyChart and look under the tab that says clinical research. You can build a profile, select your research preferences, and the team will be in touch with you to help you find a trial. You can visit us on our website. You can actually just Google clinical trials at Yale, and it's a site that will come up, along with some really great videos of Reverend Perry and Reverend Clayton. Or you can email us at helpusdiscover or call. Let me just give that number, and then I'll turn the floor back to you, Tom, I promise. So the email is helpusdiscover@yale.edu. The telephone number is 877-978-8343. So as always on your show, when I get invited, you have to give me a minute to do my research plug.
Absolutely. I mean, and it's not, the word plug is appropriate, but it's really planting the seed for future livelihood. I mean, what more recognition do we need other than the global crisis we're in now, knowing how important health and understanding health and biology and artificial intelligence is just so key. So absolutely, if you're a young person listening, some people can be kind of somber about how the world is going, but if you're a young person, there is opportunity now to change. The word changing the world, improving the world. This is the time. Historians will look upon this time as this is a pivotal moment in terms of the future of the planet. So absolutely, research, medicine, when talked about the training programs, et cetera, so key. Doctor, we have about 8 more minutes. Dr. Churchwell, we do have a question about, is there a delineation? You mentioned the open positions, of 3,000 or so open positions. Is there a delineation in that regard about from non-clinical versus management? I mean, people have referenced kind of the various human resource categories, but is there an actual, do you have a better feel for the division? Do you have is it 1,000 management positions open, or 2,000 non-clinical positions open, or just in general?
So Tom, one of the pleasures of being in my position is I can always phone a friend to get actually a great degree of expertise.
Excellent.
So I'm going to phone a friend. And Dory, what's the breakdown from your perspective?
I don't have a complete breakdown, but more than 60% are clinical and management positions.
Excellent, excellent. Let's open it up. We have about eight or so more minutes about just the glimpses into the future. I mean, the reason one of the various reasons I love doing the show is the ability to kind of collectively brainstorm and vision and become visionary. So just Dr. Churchill, I want to start with you as well about the future programs, future initiatives. You've been quiet as it's kept and not so quiet for those that have followed your career involved with this issue of the institution of hospitals, as well as the policy, as well as administration, as well, and you're a doctor as well. But as you put on your crystal ball and have your dreams, what are some future programs and future endeavors that you'd like to see that might be related to really the keeping the planet healthy?
So, Tom, it's a great question. There has been not an insignificant amount of work here and really across the country of thinking about how do we make our population healthier, truly healthy. How do we actually invest in work and an effort to optimize the health of all individuals? And it has become very evident in that it's not just about pills, but it's about a number of the issues that you actually touched upon in the last 40 minutes, about the issues of disparity and also social determinants. I think more and more institutions like ours, our health systems like ours, are actually identifying this as part of their work. How do we invest in that work, not only in the work of defining what the issues are, actually bringing a great degree of scientific rigor around the opportunities that may present, that may need to be tested, but also incorporating that into all of our ideas and opportunities in terms of delivering care. So as the pandemic hopefully starts to wane and the lessons that we've learned from that, coupled with the need for us to really think about our population in its totality in a very holistic way, I think we'll continue to work on the ideas and actually the initiatives that speak towards the development of a plan of care for patients that actually follows them through their overall health life, right? That actually speaks to how do we develop that plan to optimize the true health of our patient and of our population. That has to be more than just the pills or the procedures that we do, but also that investment by us and by many others in the development of plans that support individuals around their education, around their nutritional status, around transportation, and around where they live and how they live, so that we truly have a healthy community.
Excellent, excellent. Dr. Belcezak, would you like to weigh in on that?
I think Keith did a really nice job of sort of, outlining an optimistic view for our future. And I think, we need to come together in a way that we have never come together before to support one another in that vision. And I appreciate you coming on this show, putting this show together for us, because we do need to collectively work on making our communities a better place, to build opportunities for our next generation. And at its core, I think, as Reverend Clayton said, it takes money to do it. And we've got a little money from this grant. And hopefully this will be one small step or one link in the chain of doing exactly that, which is providing an optimistic future for future people that are going to come and fill these chairs and do these jobs, and hopefully take care of us when we get into our dotage, and that this health system is there for us and the support system is there for us. And we're all in this together. And I think underscore that in this time when so many divisive voices out there, we need to remind each other is that we're a lot more alike than we are different. And we better work collectively hard to make this place a great place for us and for the generations behind us.
Amen, brother. Well said, Tom.
Reverend Perry, Reverend Clayton, before I come to you, Dr. Belcezak, I just wanted to follow up. Since I am a member of the Dotage Club, for those of you that don't know what that DOTAG word means, it's AARP plus.
I get my asks from the AARP too, Tom.
But Dr. Belcezak, it was reported that you had to you're expanding the emergency room because of anticipating that additional people will get sick. And I just admire those of you that are warriors in this healthcare field, because I know you had to think why in heaven do we have to expand the room if people just behave? Well, let me talk my soapbox. But share about the emergency room and just the predictive analytics that you have to go through and churn, and the data numbers every day to kind of anticipate and meet our needs, whether we human beings want to smoke or not smoke.
Yeah, well, we're here to take care of people. We're not here to judge them, and we need to take care of everybody. And it's a sad fact of life that people are going to get hurt. But again, I think if we can come together and look, smoking rates are down across the country right now. And we didn't get there in a day. We didn't get there in a week. It took us a lot of time and effort and a lot of campaigns to reduce smoking rates. And there's a lot of other things we can do to help improve people's health. And, I think we just need to, we need to believe in the best of everyone and get there with a positive light, not with a negative light.
Excellent. Reverend Perry and Reverend Clayton, kind of close us out. We have about 2 minutes, and Harry will play the music. You guys know the drill. But I wonder, Reverend Clayton, if you'd like to share any kind of closing thoughts or questions or even challenges.
Well, I would like to take a personal privilege at this time to say to you, Tom, that you have my condolences, and we pray that our God will give you and your family all that you need at this time.
Thank you. Thank you. Reverend Perry?
I think I would echo that. And I would also like to add, though, Dr. Churchill was talking about this pipeline that you follow a person's health throughout their career. And I think that's what we're trying to do with our program. So we are looking to be able to do a pipeline. We're looking at our young people. So we've got young ambassadors now who are in training. We're looking at high school and college students. And I think this is one of the things that we need to pull together to make this plan come together in a better way. Because we just can't, I was thinking about Dr. Churchwell, and I was saying to myself, his parents must have had some kind of secret ingredient that they got him and his brother into this field, and they prosper at it. We've got to find that formula and give back to our community to make this picture complete for all of us.
Indeed. Dory, just my spirit tells me to ask you, what maybe 30 seconds, any closing thoughts? Because I guess, am committed and persuaded and motivated by and inspired by what you're involved with.
Sure. Actually, I'd like to share our website. I'm going to put a little pitch in there also. So our website is www.ynhh.org/careers. And if you are looking to have, be part of the referral program for YCCI ambassadors, that is how the referral is listed. And actually that will be up and running the beginning of next week as we're implementing that as we speak. So, if you want to apply, please go on our website, apply, and we look forward to this great partnership.
Excellent. And Judith?
Yes, so please, if you're interested in any unlicensed assisted personnel jobs, they're listed on that website as patient care technicians. So go ahead and log in and put your application in. Also, I can be reached at judith.hahn, HAHN, @ynhh.org. I will personally talk to anyone about our grant. I'm so excited about it.
Thank you. Welcome, and thank you, everyone. Happy holidays. See you soon. Thanks for joining us.
Thanks, Tom.
Next time.
This is Harry Curry, and you're listening to WNHHLP 103.5 FM New Haven.
Better watch the way you're going, better go in the right direction. In the moment you stressing, but you're gonna be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna get